Good morning. I'm Dr. Robert Parker with Parker Foot and Ankle and Neuropathy Care Center of Houston. I am double boarded in foot and ankle surgery and minimally invasive foot and ankle surgery and specialize in peripheral nerve surgery. That is the system of nerves that are beyond your brain and spinal cord and out into your extremities, called peripheral nerves. You know, I love bronze, and in the background you see one of my favorite here by Rick Ronish. I was honored to meet him back in the 70s. It's called On the Hook. These riders are skilled in riding. In fact, polo began years ago, centuries ago, where the riders needed to keep their skills up for battle. And so they created games such as polo to keep those skills up. The thing that I want to bring out about this bronze, which is beautiful, unlike artwork that you cannot touch, shouldn't touch. I love to touch bronze. You can feel the temperature, the texture. Look at it, admire it, and you won't hurt it. But these riders are skilled in riding horses, skilled in hitting the ball, and the ball itself makes the difference. You notice this is not a football, it's not a basketball, it's not a soccer ball. It's a polo ball. Just like our nerve conditions, you have multiple different types of nerves and thousands of different conditions affecting your nerves. So what is that specific mallet skill set in order to hit that hook, if you will, to get that hook to hit the nerve pain? Today, we're going to talk about chronic pain. You know you might have heard about spinal stimulators. They've been out since the 60s, actually, where the pain management doctors will take a spinal stimulator and put it up near your nerve coming out of your spine and try and block the pain message going to your brain from that painful source. This is not new science, but this concept has to do with the large nerves coming out of your spine. There's a mindset out there for pain management. If you block the nerve at the spine, you can eradicate pain down the lower extremity. And this is true. This has worked for many years. However, it's a major procedure to implant this spinal cord stimulator near your spine. This is not what I'm talking about today. Today, doctors trained in the Johns Hopkins technique called Dulin decompression have been treating chronic pain in the lower extremity by addressing it at the source. And that would be in the lower extremity itself and not going all the way back up to the spine. You know, if you think about our nerves like electricity, you have the power source, let's say the power plant in your city. The power plant then sends the electricity to the pole where your transformer is that goes to your house. And that big wire going to your house then divides into a what? Into this box that has circuit breakers. These circuit breakers go to each area of your home and goes down through a wire, an independent wire, to a plug. And then the plug plugs into a toaster, a oven, a stove, a lamp. So for many years, in fact, in my case, 20 years, I've dedicated my life to the Association of Extremity Nerve Surgeons techniques and procedures specifically to hit the polo ball and not to hit a football or to hit another kind of ball, but the polo ball representing that specific nerve pain at the source. So what kind of pain are we talking about here? This is pain that is caused from failed surgeries, from injuries, from compression neuropathy, which is the Johns Hopkins cases, and we'll get into double crush theory in just a little bit. Doctors like me have been focused on nerve conditions outside of the spine, not at the spinal cord. So imagine now we have new technique, we have new instrumentation for delivering the same treatment that you would get with spinal cord stimulator. However, it's down at the source, in the peripheral nerves, out in your extremity, down where the pain is. So chronic pain such as tarsal tunnel syndrome and nerve pain where you have an entrapment or injury is so bad and so bothersome 24/7 for many people that they cannot sleep. Their own medications such as Neurontin, Lyrica, Cymbalta The diabetic with their peripheral neuropathy, which is actually most of the time a compression neuropathy, meaning that the nerves are entrapped because the nerves swell in the diabetic, and it's as though having your ring on your finger and you've injured your ring, you're in the emergency room, your finger is swollen 3 times its size. What's the first thing the doctor is going to do is get that ring off to let the circulation and the normal function of that finger go on to heal normally. If you leave the ring compressing that finger, not allowing it to have its normal function, you could lose your finger. So the nerves in the diabetic are similar. They get pinched and they get compressed. The metabolic pathways in the aberration of the diabetics causes swelling in the nerves, which causes compression, as well as the other sugar damages done over the years where the nerves are caked up with what's called AGEs, advanced glycosylation end products. And those outer crusty formations on the outside of the nerve and then the nerve swelling from the inside creates the compression, like falling asleep on your elbow and your hand going to sleep. Burning, tingling, numbing occurs. So these are chronic conditions we call chronic pain that we're going to address today with this new technology. So what are we talking about here? We're not talking about the 1960s technology, which has worked well for the spinal cord. Now we can place this nerve stimulator in the lower extremity next to the nerve that's sending the pain signals, the chronic pain signals, back to the brain, and scramble that message to the brain so that the pain is gone away. This is called nerve modulation, by the way. When you stimulate the nerve, you're actually modulating the signal going back to the brain so that your brain does not sense that pain. So what is it? It's a small wire, no longer than about this length, that's placed under the skin near the traumatized or damaged nerve. Then the signal that's sent from the outside of the skin, outside of your leg or arm, the message is sent to modulate that pain in the nerve and block and scramble the message going back to your brain. It's that simple. So we don't go straight to surgery. We have many procedures that we can do that are conservative. We also have pharmaceutical grade nutritional products that can keep your immune system up. There have been several studies, one done by Dr. Alan Jacobs, showing that certain nutrients will reboot the small fibers in your skin, which gives you more sensation, less burning, and less tingling and less numbing over a period of time of taking these supplements. Other treatments such as Synexus, which is a electrical cell signaling where we put a local anesthetic to increase the blood supply to your nerves and then run several courses of nerves stimulation with an outside suction cup, sort of like the Michael Phelps suction cups back in the Olympics, coupled with the electric currents that go through multiple channels and multiple cycles, and that can reboot your nerves. These are all conservative treatments that we have found to be successful. We also have hydrodissection, which is the way that we place growth factors, umbilical cord allograft in and around your nerves to help your tissues by cushioning the nerves. We have class 4 laser machines, which are several. We have MLS, we have K laser, we have blue laser. All of these are helpful in the therapeutic treatment and enhancement of our tissues healing. So no, we don't go straight to surgery. However, if surgery is necessary, what kind of conditions do we treat? The chronic pain from tarsal tunnel. There are people who have tarsal tunnel procedures and they are not successful. We have special training, the Johns Hopkins technique, created by Dr. A. Lee Dillon. And this is my mentor, the doctor that trained me, and I want to give him credit for that. But over 20 years now, we teach us courses, cadaver courses, for other board-certified surgeons to learn nerve surgery. And we have found tremendous success with these. However, there are times where even these, the latest in peripheral nerve surgery for neuropathy, are not helpful. And now what do? the patients in chronic pain? Do we put them back on Cymbalta? Do we put them on Lyrica? Do we put them on narcotics? I have many patients in here that come in at this scenario. They've had all of these conservative treatments and surgical treatments, and now they have failure. For years, we had nothing to do for this. This is all changed now with our new treatment with nerve stimulators known as Stim router. I have performed these procedures with great success, and you may see testimonials from our patients that have had this chronic pain totally resolved, or at least 50% resolution of their pain from nerve stimulators. The Stim router is a whole new game now for us. So
It's been since Wednesday, so today is day 6.
Mm-hmm.
So really the first day was driving home after surgery. I have slept straight through.
Wow.
With no issues every night, every single night. It's just calm, and that's really the best word to say. You know, the left foot has its issues. We're going to talk about that, but this is calm.
I believe this is a huge advancement in treating chronic pain in the lower extremity for peripheral nerve. I hope this video has been helpful for you to learn about an exciting new treatment for chronic nerve pain in the lower extremity. I'm Dr. Robert Parker, Parker Foot and Ankle, and the Neuropathy Care Center of Houston. Thank you.